Hi, I'm Craig Ellenport. Welcome to the Pain is the Pits podcast on the Health Styles Network and healthstylesnetwork.com. I'm joined today by founder of the Pain is the Pits program, Dr. Peter Kachajian.
Hello, everyone.
How are you doing?
Doing well, Craig.
Excellent. We're, we were looking at some recent statistics on pain, and the one line that struck me, and it wasn't one with an actual number attached to it, but from the National Institute of Health, was the line that chronic pain is the most common cause of long-term disability in America.
Right.
Which led me to the first thing I thought of is what makes it chronic? What makes pain chronic?
Right, so chronic pain starts as acute pain, whether it's from an accident, a slip and fall, a motor vehicle, or work-related, or folks are just getting older and they're developing arthritis. There's an acute process that develops first, which in many cases, especially after accidents or operations, gets better in a week or two or a month or two. But if it doesn't, and the body gets sensitized, the mind and body, then it goes on to chronic pain, especially if it persists for 3 months, 6 months, even beyond a year. So it's this time frame, right? Everything starts acute, most goes away, but that 10% that doesn't, then we have to be prepared on a chronic pain basis. Hence the Pain is the Pits program, an integrative chronic pain program to try to help form this treatment program, like any other treatment, cancer, diabetes, heart attack.
And we'll talk more about the treatment
Sure.
options and ideas, and obviously we embrace the integrative approach in looking at many different options together.
Right.
But my question is, so if someone has an acute pain,
Right.
and whether they treat it or, I mean, part of what I'm understanding here, it sounds like you're saying is that whether it's treated or not, it can easily become chronic.
Yeah, it settles down on its own.
But here's the thing. So the problem, I think, what a lot of people might not realize is that if they have acute pain, if they have back pain for the first time and think, I'm just going to deal with it because it's going to go away in a few days, maybe a week or something like that, and they don't seek special treatment for it.
No, not
They're
in
probably-
a day or two pulling your back out. Usually just do symptomatic treatment at home.
But are the chances greater that it's going to become chronic if they ignore it?
Well, not in the beginning. You know, the recommendation after acute back or neck pain is to rest for a few days. Not for longer, because then you start getting deconditioned. But you rest for a few days, you do the heat and the ice, and you take your anti-inflammatories or your Tylenol, and it is self-limited. You might go for a massage, or you might know an acupuncturist. But by waiting, you're not hurting yourself, because it's going to settle down more times than not. You don't have to rush off for an MRI. You don't have to go to your local spine surgeon. No. Back and neck, most of it settles down after acute injury from whatever causes. Depends on the mechanism of action. If you're really worried about neurologic status and things like that, yes, you're going to move quicker towards doing something in the healthcare, but most is self-limited initially.
So then, I mean, if it becomes chronic because it's not getting better,
Yeah, it's like meant to be.
what are some of the reasons for that?
Well, persistent pain from whatever your injury is. If you have a large herniated disc, which again, in a month or two, especially 3 or 4 months, 90% should heal. The inflammation goes down, the disc desiccates, it dries up, it pulls off the nerve, you don't have to pinch nerve anymore, you start to feel better, you have like less back spasm, less sciatica pain, and you get back to your normal activity. That's the normal course of a herniated disc, but sometimes, say 10% of the time, it's persistent, despite conservative, despite anti-inflammatories and rest and heat and physical therapy and chiropractic care. And even if you go for shots, right, your epidural shots, your trigger points, and well, oh my gosh, it's 3 months gone by, it's 6 months, all of a sudden you're off to see a spine surgeon, now it's becoming more of a chronic pain process, and now all of a sudden you have to start doing more advanced care, and now it's not so conservative, you're looking at more aggressive things like a discectomy with the spine surgeon, or God forbid a spinal fusion because you have multi-level instability. These are the potential scenarios. So say 90% is going to be conservative, and about 10% in a lifetime you have to go have spine surgery because it got so bad. Different scenarios. It's patient specific. We take each case.
So now looking at it that way,
Right.
You, Dr. Kachajian, as a pain management specialist, I guess the point is most of the patients you see are already chronic, because if they weren't chronic pain yet, they're not going that far. They're going
Yeah,
to...
and they're moderate to high impact patients. You know, the low impact patients, say there's 100 million chronic pain sufferers. About 70% is low impact. And a lot of them are being seen by their internal medicine doctor, family practice doctor, chiropractor. They're handling it. But those moderate to severe impacts, the patients who really progress to strong a disabled pain are going to see a specialist like me. You know, about 2% of the patients in America are going to see a high-end, board-certified anesthesia interventionalist like myself. 2% of the 100 million chronic pain sufferers. But those patients are usually the most miserable and the most deemed chronic, and those much more likely to be disabled, where they're just not functional, just not working, they're very depressed, they're very dependent, and they need the most attention. So they're the ones who are going to seek really the high-end care.
Is there a point? You know, there's no test and there's no number. You know, but is there? At what point would a general practitioner who's seeing a patient for a bad back or neck, after a couple of times that he's seen them, say, "This is chronic"?
Yeah,
I mean, is there a point?
Well, there's not an exact point. It's more, you know, if you go academically, it's, hey, if it's less than 3 months, you know, it's acute. If it goes for 3 to 6 months, it's subacute. If it goes beyond 6 months, it's chronic. But really, you have to look at the time of injury and the expected time of healing. If you're having pain beyond the expected time of healing, that's considered chronic. You don't have to wait the 3 months to 6 months to 9 months to a year. If you have, you know, a herniated disc and you have a certain time frame where it's supposed to be healed, say a month or two, and you're going beyond that, that's chronic. It doesn't have to be the exact time, but that's the academics. Beyond 3 months, chronic. Short of 3 months, acute.
So, if someone is being treated for a bad back,
Right. And there's millions of Americans.
now I'll sort of answer my own question here a little bit, because what I was going to get at is, if you're treated for an acute pain and all of a sudden it is now considered chronic,
Right.
does that change the treatment plans?
It does.
I guess to a certain extent, it's
Think
going to
about
change.
it.
It's going to change to a certain extent, because obviously what you were doing wasn't working.
Right, and you need a long-term plan. You need a long-term program. Just like a diabetic does, a high blood pressure patient, a stroke victim. That's why I made the PITS philosophy into a program called the Pain is the PITS program. You have to start developing a therapy plan, mind and body, for chronic pain, because you have to stay functional and you have to keep, you know, elevated in your mind so you can fight back the disability that chronic pain gives you. Then you have to develop a medication strategy. We call it a pill strategy, different pills. And then sometimes you need injection strategies along the way, because chronic pain is persistent at times and has acute episodes on top of chronic. And then eventually a surgical strategy if you get that bad, right? Everyone knows somebody who had a back operation maybe, or a neck operation, or some kind of operation. And operations are there as the fix solution, so to speak, but not necessarily like end chronic pain, but to help along a conservative to more aggressive strategy of pill, injection therapy, surgery. So the key is you have to have a program. That's the key behind anything, any chronic disease process. There is no national pain program as simple as the one I envisioned. Yeah, the national pain strategy, the organizations, the pain societies, the professors, the government, they're all working at that top end to develop a national pain strategy, but they need help. They need help at the patient education level, and I think PITS is the program.
And you touched on it. You mentioned diabetes, and we've talked
Yeah.
about this before in terms of pain is the PITS, and looking at chronic pain. And so specific, not just, I mean, pain to a certain extent, but really chronic pain as
Yeah.
chronic pain as a disease, and you treat it as something that you manage.
And that's what's leading to disability.
You're not going to cure it. You're managing
Can't be
it.
cured. Very rare to cure chronic pain.
So what if you, I mean, does it help to look at it the minute you have that acute pain to treat it?
Yeah,
In a
you
chronic-
got to be aggressive. You don't have to treat acute pain as chronic. It's supposed to get better. But you have to treat it aggressively. You have to stop this barrage of pain impulses into the central nervous system and brain that lead to sensitization and sets you up for chronic pain. So aggressive early care, especially after operations, especially after trauma and broken bones and accidents, you have to get that under control faster than later, so that you decrease the incidence of developing chronic pain. Early care leads to better care. And actually, think about it. If you get the worker back, say a workers' compensation patient, if you get them back to work earlier than later, then they're not going to be disabled. They're going to get back to earning money and having a job.
That's right.
Yeah, very important.
And we
Motor
talked.
vehicle accident patients, right? You got to get them back.
We talked about the other statistic in terms of a large percentage of chronic pain sufferers who, especially back pain sufferers, are, and I think really is back pain sufferers more than most. Depression, negative psychological effects are a big part of that too. So
People aren't used to staying home when they're workers,
when a pain
especially
is,
the guys.
nobody's happy about having pain in short term
No.
time
Yeah, but everyone
frame,
understands that.
but once it's chronic, yeah, that's
Yeah, chronic pain's much more difficult to get a handle around.
and so
You
as
say, why isn't this going away? I've healed. Why do I still hurt? Right? Pain beyond healing. And that's a tough one for most folks with chronic pain to understand, but they got to understand it. Because once you understand it and you're more accepting of it, you can develop your long-term pain strategy in a program.
right.
And a lot of that is understanding that you have to get control of the psychological and emotional component of your pain because it exacerbates the physical. And you got to get control of your social components of your pain because that exacerbates the physical. And you got to do your best you can to control the actual intensity of the pain because that's the key. Control intensity, how frequent it is, and minimize side effects. When you actually treat the pain as aggressively as possible, the rest of your care fits into place. You're more functional, you're less depressed, and you're more social.
Yep, it all fits together, and I guess, and as we've talked about, education and motivation is a big part of that too, and that psychological component comes into play. All of these things, really have to be thought out when it's chronic, because when it's chronic, it's for life. It's a disease, and it's something you
and
manage.
a lot of chronic pain develops because it's got the best. It's got your You've lost your psychological edge, right? A lot of people, if they're motivated to get back to work, they will. And if patients are not motivated and psychologically they're really, they have a disabled mind, so to speak, and they're not strong enough or willing enough to work through their injury and try to get, back to work and not disabled, they don't do it. So a lot of chronic pain has deep psychological roots. If you're not psychologically strong, then you're more likely to develop chronic pain. That's a statistic. And certainly the severity of your injury and the type of pain, obviously, it's more prone to be disabling than others. Take tension headaches. Most people work through tension headaches, the kind of muscular, kind of periodic end-of-the-day headaches, busy day at work, busy day with the kids. Tension headaches don't seem to be as disabling as migraine headaches, a much more severe type of headache for patients. Millions of pain sufferers with migraine headaches, they seem to be more disabling. Just like, hey, if you have a muscular backache that you work through and you've just done too much and you don't have a pinched nerve, those are less disabling, say, than a patient with a herniated disc in their back and they have a different reason to have pain than not just muscle, but the pinched nerve and the sciatica and the electric sensations down the leg, they tend to be more disabled unless treated more aggressively. It's just how it is. A lot of osteoarthritis pain. People live with osteoarthritis, so normal aging of their joints, and they live with that, and it doesn't have to be as disabling, say, as rheumatoid arthritis, the kind of autoimmune medical arthritis that destroys your joints through inflammation from autoimmune disease, and that could be, more disabling for some than the run-of-the-course normal degenerative wear and tear osteoarthritis. There's different levels.
Yeah. It's and again, understanding it helps you cope and manage.
Yeah, and it decreases disability once you understand it better and you can understand how to dig yourself out of this pain mess.
Yep.
Following this program that I've developed and that we've talked about now for over a year, and we're growing the doctors network and more doctors get involved, and then the doctors can spread the news to their patients, and developing this terrific medical wellness pain program should serve America well in the upcoming years. That's my prediction.
Well, I hope so. I think that sounds great. And, as we've talked about again, it starts with going onto healthstylesnetwork.com and taking your pain and quality of life score and
Very important, America.
and go from there, because that will tell you the areas you need to improve to get that score up. And again, not something that necessarily is going to cure pain, but is going to help people manage their pain.
Yeah, and you'll see a hell of an improvement in your pain and quality of life.
That sounds
It's
good.
worked for me. Don't forget, Craig and I are chronic pain sufferers, America, and it worked for us, and we're giving our knowledge both as pain sufferers and experts of what we talk about to you so that you can advance your own comfort,
The other keyword that
and not be so disabled.
the other keyword that you've used very often and rightfully so is proactive, and that's what they need to do, to be proactive in their pain care.
As opposed to reactive.
That's right. That's right. So hopefully this has been helpful. Hopefully listeners can go from here and be proactive and take control and better manage their chronic pain. If it's not chronic but you have some pain, and do what you can to manage that before it gets chronic, and hopefully it won't. So keep on listening to the podcast here, and check out the content on healthstylesnetwork.com for more helpful information that can help you take control. And we'll talk to you again soon. Again, for healthstylesnetwork.com and Pain is the Pits, I'm Craig Ellenport. Thank you to Dr. Peter Kachajian, as always.
And remember our motto, feel better and live your life, because pain is the pits.